Hi, my name is Rick. I have prostate cancer. This is my treatment story.
My name's Florence, and I'm one of the nurses, and I met you when you came for your initial consult visit. We meet with everybody on the first day of treatment just to make sure you remember how many treatments Dr. Hung told you to expect, and to kind of just review to make sure you understand and remember kind of what the more common side effects of your treatment could be. Dr. Hung has prescribed 28 treatments for you. If for some reason you are unable to make a treatment, for some reason, we simply add that number onto the end. So it's the total number of treatments rather than the weeks of treatment that turn out to be important. In general, this treatment is very well tolerated. Probably the most common side effect that men experience as they go through treatment is a sense of maybe being a little more tired than normal. You shouldn't notice that for several weeks as we get into treatment. Sometimes along about the 4th or 5th week of treatment, men notice that they just kind of are a little more tired as they run out, they get to the end of the day. If you feel like you want to sleep for long periods of time, that's not normal, so please let us know. This shouldn't significantly impact your quality of life. Because of where we're treating, as you know, the prostate sits in your pelvis, your bladder and your rectum kind of sit in front of and back of it, so we can cause some bladder irritability. That would show itself up as maybe some urgency when you need to urinate, maybe some more frequency, and men usually notice that at nighttime because they get up fairly often. We can also make your bowel a little more irritable, and again that shows itself out as being some urgency when you need to have a bowel movement. The only place we cause side effects other than making you feel a little more tired than normal is right where we treat you. So we're not going to give you a headache, we shouldn't make you feel nauseated, we're not going to make your feet hurt, none of that. It's just strictly related to where we're treating.
Somebody asked me the other day about hair loss. Do you lose any hair just from that area or nothing?
No, and usually not even pubic hair loss.
Okay.
And usually not much skin redness either. That's a common side effect with people who get treatment with cancers that are very close to the skin surface, but not with prostate cancer. Once a week you'll meet with Dr. Hung, and that's usually on Mondays. It'll be done right around the time of your treatment. If you saw Dr. Hung on Monday and things were just great, but by Wednesday or Thursday you were having some side effects you wanted to talk about, when you come for your treatment, just ask to talk to the nurses. We're always around. We can find out what's going on. If we need to get you a medication, we can check with the physician about that. If we need to have somebody come see you, we can do that also.
Hi, my name is Bonnie Ludloff, and I'm a radiation therapist. And we're about to give a radiation treatment with the Calypso unit for prostate. Feet down here. Okay, and go ahead and lay back. And just scoot up on the table a little bit. Just, yeah, there. I just want to make sure you're, okay, and then go ahead and lower your bloomers.
I love when you say that.
Okay, so now what we're going to do, we're going to keep you covered. So you can go ahead and start raising. And I'm going to get the Calypso unit. So now we're going to line up your tattoo dots with our lasers. You can just midline the. So now we're going to line up our Calypso panel. And this is picking up the beacons that have been implanted in your prostate. And now it's tracking the beacons. We have our cameras up here.
Are those just watching me?
Actually, they're watching your beacons.
They do? How'd they do that?
Well, the panel is a transducer, and so it tracks them.
That's pretty cool.
So now we're moving the table to set up your beacons for treatment. Just set up your prostate. Okay. Now we're just waiting for the beacons to be tracked. These arms are going to come out on the sides. We're going to take a film. Dr. Hung is going to read it to verify. And then once he gives his approval, we'll go ahead and treat. And the machine will just move around you twice to give you your treatment.
So that thing goes like around me like that and shoots radiation all the way through?
Uh-huh.
Okay.
Yeah. And so what we're about to do is take a cone beam, and that's to verify that the Calypso beacons are right where they should be. And over here, this is the screen tracking the Calypso beacons. And we have cameras and an intercom on for our patient, so that in case they need us for anything, they can give a holler and we can go in. And so once we get our images up and aligned, we'll call Dr. Hung, and he'll come and verify the beacon placements with the patient's anatomy. So on the left side, we have the film that we just took, and on the right side is the film that was taken in simulation when they took the first film to set up the treatment planning. The two images are superimposed. In the process of this, the Calypso unit is continually tracking the beacons, so that if the prostate moves, we can move the table and adjust for it. This is the AP, this is a lateral, and this is the cross section. And then here's the other two beacons, the cross section, the AP, and the lateral.
It's not as bad as you think it's going to be. It's just kind of creepy because you know that something, you don't know what that's doing, and you see these little green things coming out of the middle, and you know that it's doing a good thing, but you just pray to God that it's not going to do a bad thing. So now from here on out, I see what they mean. It won't be that bad. I mean, because you can kind of get it. It's kind of apprehensive though, because and it's a big machine.
The Calypso is the only technology that enables us in real time, while you're getting treated, to tell that the radiation's focused on the prostate during that whole time that the beam is on.
So if I'm in there and I stir or I move or something happens, what happens with this shut?
We will see it. We will see it shift, and if it moves out of our tolerances, which our tolerances are set at 4 millimeters, which is, if you to convert it to inches, it's probably about a 1/16 of an inch, pretty tight.